95% of referrals from an allopathic medicine doctor do not need surgery. What does that mean? That chiropractors in general, or physical medicine doctors that work on these issues, can filter out the disorders before they need actually surgical intervention. This is just a concept that is just out there. It seems like it's a little bit abstract in the concepts, but actually determining what is surgical is important, because a lot of people don't need surgery. That's one of the things. Do they need autoimmune medicines? Maybe. The idea is that we have to work with rheumatologists and specialists that work on different disorders to come up what is best for the patient and what is necessary. Not necessarily always do we need surgery, and not necessarily always do we need medications. We've learned the consequence of medication. We've learned the consequence that every medication has a side effect. Sometimes when you take 2, well, sometimes you can understand what the side effects are. But when you start taking 3, 4, 5, 6, 10, 15 at times, even a pharmacy of stuff, you really don't know what the side effects are, and may be causing other issues like emotional issues, neurological issues, neurodegenerative disorders. It crisscrosses. So the best way to do it is to have a unified treatment protocol with multiple different providers treating an issue. Now, I have a great panel here, and what we're going to be discussing is what we do in our particular office. And what we do in our office is determine what's best for the patient, with putting a whole team around them, from orthopedists to neurologists, to figure out what integrative medicine is about. Because there is a place, and modern medicine requires integrative medicine in whole health and in whole fitness. So we are today in a wonderful site located here in El Paso. We're in a beautiful fitness facility, actually, where we treat athletes. Some of the top athletes work in this very building that we're in, that are actually young kids from 4 to 5 years old, when they can pay attention, to the Division I athletes, and some even deciding to be Olympic candidates. So when you see athletes and you understand the dynamic movements going through their injury processes, is a whole body assessment that we have to figure out. It's a lifetime change, and it's a lifetime assessment. So having great doctors is very important. I'm glad to say that we have a lot here, and a lot around the country. So what we have to do is actually bring up the awareness as to why we treat the motion issues, okay? Now, beyond motion, one of the common parallels that we have is inflammation. Inflammation seems to be one of the lines, the things that kind of connect every one of these disorders into one disorder to the other, whether it's rheumatoid, inflammation, diabetes, inflammation, such as pancreatic cells. We have liver inflammation. We have disorders that cause problems with the intestinal dysbiosis, inflammation of the gut. That has relationship to the bones, to joints. And what we need to do is we need to understand that as a team, we need to ferret out the questions to basically find out. When patients present to us, they present to us as almost like a one two-dimensional object, basically with just like I'd call it like a domino. I see a domino, and I got presentations that are the symptoms and objective, subjective findings. Beyond that, what we do is we sometimes just get the initial subjective and findings, but we need to find the history. We need to go back. We need to go back a couple of dominoes ago. What happened 6 months ago? What happened a year ago? These things correlate. So in that sense, what we do is we have to do a thorough assessment. And doctors that in today's world, we use other people to help us and find out, nutritionists, health coaches, to figure out what's going on with the story. What is the biochemical makeup of the individual having these issues? Today, I'd like to introduce you one of our awesome staff people. That's our chief clinician in terms of coaching. What we got to do is we got to introduce her. Her name is Kenavon. She is responsible for helping people find out the cause and the reason why they have issues that are beyond the normal biomechanical issues, and find out where in the history the issues are at. Today, Kenna, tell the people what it is you do and how it is you kind of integrate with a functional medicine type of practice.
All right. The first thing that we make sure we do at our practice is make sure that every single patient is heard, because it is so important. And just like Dr. Jimenez was talking about, when you look at a patient, you don't always get everything right from the beginning. So we want to make sure we go back and we get that detailed history, and we ask those really important questions that make the patients think, finally someone's hearing me and I'm not crazy. So we ask questions like your dental fillings, because most people don't realize that the mercury in those can cause inflammation in your gut, which then can cause brain fog, which then can cause all these other issues that start. So that's the main thing that we start with, is getting that real detailed history. And from there, we work with your lifestyle to make attainable goals. we make changes. We can do all natural supplements, which are perfect for the lifestyle that to take away that inflammation, because most of them are vegan. They don't include any dairy. They don't include any eggs. They don't include any soy, things like that that can cause inflammation in people that they might not realize. And also we work with a great team of labs that will help us take normal blood work and just really dig down and get those actual answers. And we can look at food sensitivities, hormones, cortisol. We can just take it in all different directions to really get down to that nitty gritty to figure out why they're having inflammation and how we can get their body back to normal so they can garden with their grandma or things like that.